Are you recording? Okay, good. All right. Good afternoon, everybody. Thank you for joining us and welcome to, this is day 15 of our 18-day marathon session on COVID-19 and how to deal with COVID-19. And I'm honored to welcome Dr. Aysha Akhtar for our conversation today, because she's one of the leading experts on pandemics and public health. And I saw her TED Talk, I think a couple of years ago, and I was blown away. Here was someone who was addressing the root cause of the problem, as opposed to, because as an engineer, I was flabbergasted that people don't really talk about the root cause. And engineers are trained to do that because otherwise we cannot build anything that works. So it was shocking to me that in the environmental arena, people were not talking about the root cause at all. And he was someone who was addressing it point blank, telling us the truth that we need to hear. So Dr. Akhtar is now the CEO of the Center for Contemporary Sciences, where she'll be working on eliminating animal experimentation in research labs and so on. And she's a double board certified medical professional and an all-around amazing human being. Thank you so much for joining us.
Hi, Sash. Thank you so much for having me. And those are extremely, extremely exaggerated and kind words.
No, you deserve it. Tell us how you got into studying pandemics and the background here.
Sure. So a couple of things. I was, for about 5 years, I worked in the Office of Counterterrorism and Emerging Threats at the Food and Drug Administration. And basically, we were dealing with what could be potential biothreats used as terrorist weapons, or what we call emerging infectious diseases. And these are either new infectious diseases that we've never encountered before, like COVID, the current coronavirus, or infectious diseases that spread to places where it may not have existed before. And so in the 5 years I worked with, I collaborated with other scientists from the CDC, National Institutes of Health, the military, Department of Homeland Security, FDA, and so on. And in all our conversations, we never once addressed the root cause of these emerging infectious diseases. We only talked about what do we do once it happens? You know, what do we do? What medications, what vaccines, what experiments do we need to do once the infectious disease emerges? But we never once, leadership, in my conversations, at least in my meetings, leadership never cared about the root causes. And that was incredibly, incredibly frustrating for me. And we are seeing the repercussions of that today.
Mm-hmm. So but they allowed you to study the root cause? Or how did that happen?
No, so the root causes, separately went and looked into that. And I wrote a book, Animals and Public Health. And I looked into the many ways in which how we interact with and how we treat other animals, how that impacts our health, whether we're talking about emotional health or physical health. And so one of the big topics I looked at was the risks of infectious diseases. And so I looked at the published data, the information out there about the risk of infectious diseases that come from other animals. These are called zoonotic diseases. These are infections that can be passed from an animal to human or vice versa, from humans to other animals. And I looked at where these were coming from. And, you know, it's amazing. We've known about these root causes for several decades now. We've known this, and public health agencies have known this too. But they've collectively put their head in the sand and just failed to address these issues in the first place.
Why is that? And how do we address that, right?
Well, as human beings, we're not very good at looking really deeply into things, right? I think we like to look for quick fixes. And a quick fix is to try to come up with a vaccine, but a vaccine is not a cure, and a vaccine is not a prevention. And a vaccine will come when many people have already succumbed to the disease. Many people will have already died. Many people will have already suffered. Many people will have already lost their jobs. And there's no guarantee a vaccine will be safe and effective in everyone. And so, you know, this, unfortunately, this is the mentality among our public health agencies, not in every individual, but in our leadership. And the other factor that, you know, I'll say it's harder to look into the root causes and to address these root causes because they're multifactorial. And they're widespread, they're global. There's no one, we can't point to one area like Wuhan, China. We can't point to one area and say, this is the culprit for all emerging infectious diseases, because that's not the case. So to address the root causes, it takes more time, it's going to take more effort, more energy, it's more complicated. But this is what we need to do. This is absolutely what we need to do. Otherwise, we're going to see an increasing rate of pandemics in the upcoming decades.
So why do you say that? Why do you say that the rate of pandemics is going to increase in the future if we don't change?
There's several factors. One is that the global population of humans is larger, that, you know, it's higher than it's ever been before. And that makes it so easy for us, where, you know, so many of us were crowded into smaller spaces, and that makes it easier for us to transmit a virus to each other. We're traveling more than ever before. Okay, so that makes it easier for us to transmit the virus around the globe, which is what we're seeing now with the coronavirus. Third thing is that we are causing climate change. Climate change globally is causing ecosystem changes, local ecosystem changes that actually make certain viruses easier to be transmitted, and especially, for example, mosquito-borne viruses like the Zika virus. Certain factors, certain destruction of certain types of ecosystems make it easier for mosquitoes to breed, and we're more likely to catch these mosquito-borne viruses. Now, where am I? That was 3, right? So 4, 4, we have an explosion of factory farms throughout the world. And factory farms are a huge, huge culprit in the emergence of new mutations in the influenza virus. Right now, we're dealing with the coronavirus. But I'll tell you this, the coronavirus is likely a much milder virus than what we will see if we get a pandemic that really comes out with an influenza virus. Because the influenza virus, for example, there's in the 2000s, there was what's called a highly pathogenic influenza virus, H5N1, which killed, it spread throughout different parts of Southeast Asia and killed a lot of people. Now, the coronavirus currently estimates are that it's lethal in about anywhere between 2 to 3% of people who contract the infection. So that's the 2 to 3% case fatality rate. H5N1 had a 60% case fatality rate. Now imagine that, it's 60% of the people who got H5N1 died. What we're seeing now with the coronavirus is nothing compared to what we could potentially see. We were lucky, though, with the H5N1 influenza virus in that it didn't transmit so easily among people and ended up not being so widely infectious. But it's really because of and we can get into this later, because of the conditions in factory farms, we are allowing the mutation of the virus at an unprecedented rate. And this mutation rate of the influenza virus is very easily going to lead, and very likely going to lead, to a new strain that is both very infectious among humans and very deadly. And then you asked me about another reason why we're seeing new infectious diseases. 5th is that we are encroaching upon natural habitats. We're encroaching upon wildlife populations now more than ever before, in large part because we are clearing the land for factory farming, whether directly or indirectly, for feed crop production. And second, because we are more populous than ever before as a species. And so we are encroaching upon animals. We are kidnapping animals, taking them from their natural habitats, shipping them in this global trade in wildlife. I'm not talking about just the illegal wildlife trade, but the legal wildlife trade as well. So we are shipping animals around the globe. And so what we're doing is that the more we encroach upon these natural habitats, the more likely we are exposing ourselves to viruses that we've never encountered before. And so we have seen that in the past few decades with the emergence of SARS, coronavirus in 2003. That's a severe acute respiratory syndrome. We've seen it with MERS, which is the Middle Eastern respiratory syndrome. We've seen it with the H5N1 I mentioned before. There's a swine flu that we're seeing outbreaks occurring within different factory farms with pigs. We've seen this with the Nipah virus. We saw this with HIV, and we saw this with Ebola. These were viruses that were newly encountered at some point because of our encroachment upon wildlife and or the way we treat other animals in other ways, like in industrial farming.
Right.
So we are increasing this treatment of animals at a really rapid rate, and we are just making it worse for ourselves as well.
Yeah, so that was the topic of your TED Talk, right? Was that animal health is intimately connected with our health, with human health.
Yeah, it kind of sounds Pollyannish to say this, but it really is true. Ultimately, my catchphrase is what's good for animals is good for us. And when we see other animals, and I'm not just talking about endangered species, I'm talking about all animals. When we see other animals as individuals in their own right, sentient individuals who should be treated with respect, with dignity, with kindness, we are less likely to create problems that will also cause hurt for our population as well. So basically, when we treat animals well, we treat ourselves well.
Right. Yeah, explain to us how stress in animals increases the production of viruses or mutation of viruses. Yeah.
Sure. So just like in humans, when we're stressed, for whatever reason, our immune systems are more likely to be depressed. Immune systems, they're not as active, they're not as healthy. And so it makes it easy for us to catch infectious diseases when we're undergoing stress, whether we have other underlying diseases or so on, our immune systems aren't working as well. And so that's the same case. It's the same case with other animals. And in the wildlife trade, what we're doing is, I'll say this, the wildlife trade is horrible to animals. It is absolutely, absolutely cruel to animals. You're ripping animals from their habitats. They're suddenly distressed. They don't know what's happening. They're being jammed into these flimsy crates, flimsy cages, sometimes by the hundreds. They're piled on top of each other where the animals below often get smothered to death, suffocated to death. So you're putting these animals in these horrible conditions, so they are distressed, their immune systems are down. Then on top of that, you're putting these animals in close contact with each other, and you're bringing different species together who may not have normally encountered one another. So what we suspect with the coronavirus is that the coronavirus originated in fruit bats. Fruit bats don't get sick from the coronavirus, but they're victims of the wildlife trade, like so many other animals. And at some point in the wildlife trade, fruit bats may have been brought into contact with pangolins, which are a type of scaly anteater, or another species. And then the virus was transmitted from fruit bats to pangolins or another animal, and maybe to another species, and ultimately onto humans. So that's a double whammy there. We're seeing the same case in industrial farms, in factory farms. You've got animals who are in miserable conditions. Immune systems are down. They're packed, packed by the thousands, sometimes tens of thousands, sometimes hundreds of thousands in a single building and single shed. And so it makes it so easy for them to catch the virus from one another and pass it on. And each time the virus passes into another animal, it can mutate. And the virus is always mutating, and we're always playing catch up with the virus mutation rate. So we're always going to be one step behind, and the virus can mutate very quickly, again, into a form that's going to be very deadly and very contagious at the same time.
Right. So from what I understand, it's the stress in the animals that prevents their immune system from fighting this foreign virus that came into their bodies. So
Well,
then is that how it works?
the stress makes it harder for them to fight off infections. It's not the only factor.
Okay. Okay.
Animals are brought into close contact with one another. Pangolins may never have been exposed to the coronavirus before, and they might have been exposed for the first time through fruit bats, and they have no natural immunity, for example.
Right.
But then you compound that to the first time exposure with added stress, and that makes it even harder for them to fight off a new infection.
Right. Okay. Another statistic I saw is that 2/3 of new and emerging diseases come from animals.
That's correct. Yes,
right?
that is correct. Yep.
So, go ahead.
No, I was going to say we might have to rethink those statistics as well. We might find that that number is going to be increasing so that we get closer to 3/4 of emerging infectious diseases coming from animals. I don't know, but at the minimal, 2/3 of all infectious diseases that we have seen for the first time in the past few decades have come from other animals.
So my question is, where does the other 1/3 come from, or the other 1/4?
Well, again, it depends on how we define emerging infectious diseases. So emerging infectious diseases can also mean, for example, an outbreak of measles may be in a place where it's never been before, or Ebola occurring in a region where it's never been before. So it also doesn't just mean that it's come a novel infectious disease, but we're also talking about diseases that are being seen in a place where it was not seen before. Okay.
So basically then what you're saying is, if you trace it all the way back, it always comes from animals? Is that a valid thing to say?
No, I don't think we can say that. Yeah, but we do know, what I will say is that we suspect that all influenza viruses come from wild aquatic birds. So we're talking about geese and ducks, that they carried the influenza virus. But we very, very rarely ever become sick from direct contact with these animals, because something has to happen to the influenza virus for it to cause a problem in us. And that's where factory farms come in, because studies have shown that despite all attempts to keep these factory farms sanitized and closed up and immune to outside viruses and so on, that's not the case. They're porous. Factory farms are porous, and I've visited them. Anything can enter a factory farm. So viruses easily enter a factory farm, then they go through this high mutation rate, pass through very quickly through a flock of chickens or turkeys, and then they can easily transform into a new strain that is capable of causing harm to humans. Now, there's also another thing, is that pigs are what we call virus mixing vessels. Pigs can carry viruses from other chickens as well as other humans. So you take an influenza virus that may come from chickens, you take an influenza virus that may have come from humans, pigs can catch both of them, the viruses then can swap their genes within a pig. And again, this can lead to a novel strain of influenza virus that will be something that can cause a great pandemic, worse than what we're seeing now. Right.
So this is the reason why we have to keep changing our vaccines for flu every year?
Well, the reason why we keep changing, it's a little bit different. So with the flu vaccine, what we're dealing with is what we're calling antigenic drift. And basically what that means is that you've got the seasonal flu virus, and it changes over time, just like we do. Our genetic makeup slowly changes over time. A virus changes over time, but at a faster rate than humans by far. But it's a slower rate compared to how it could change. And so we have time. We can take last year's vaccine for seasonal influenza, and we can adapt it to this year's strain of seasonal influenza, because there's only going to be a few changes in the genome of the virus. When we're talking about a novel infectious disease like COVID, we call these, it's called novel coronavirus because it's the first time we've ever seen this virus. When we're talking about H5N1, it was a novel virus, novel influenza virus, the first time we ever saw the strain. We're talking about what's called antigenic shift, which is an abrupt change in the genome of the virus. It hits us by surprise, basically. So that's why it takes very long for us to come up with a virus for a novel, I'm sorry, with a vaccine for a novel virus like this.
Right. Okay. Now, you said that these novel viruses come from the wildlife trade. Wildlife trade is one of the sources of it. And it's both legal wildlife trade and illegal wildlife trade, right? What are the sources of this legal wildlife trade? Why are we doing this legal wildlife trading?
The legal wildlife trade is big business. Unfortunately, it feeds into the fur industry, into the meat industry, into the leather industry, into medicinal objects, into the pet industry, into zoos and circuses. The legal wildlife trade is rampant, and it's far larger than the illegal part of the trade. And what's more, the legal trade provides a cover for the illegal part. So as long as, and studies have shown that it provides a cover in many ways, as long as we keep the legal part, as long as we keep any part of the wildlife trade legal, we've left the doors open for the illegal trade as well.
Right. So is the US a big player in the legal wildlife trade?
The US is one of the largest importers and paradoxically one of the largest exporters of wildlife as well. So yeah, we play a huge role in this. And we've imported some infections in the past. For example, there was I'm blanking right now on the virus that we imported about a decade and a half ago. It was through a type of rat called a Gambian rat that we imported as pets. And that led to an outbreak in the Southwest. And for the life of me, I can't remember what the virus was. But so we've seen this happen in the past. And again, we've just been so lucky because what we are doing to other animals, what we're doing to the wildlife, what we're doing to our climate is destructive in so many ways. And I worry that we're just going to see more of that harm come to pass in the next few years.
Right. Well, let's say that we all start changing our minds based on the facts and we start doing the right thing. Let's assume that we have a vegan world, okay, within the next 3-4 years. What would it do to the rate of new infections that we have to face as a species?
That's a nice pipe dream. So let's pretend that we all suddenly became vegan.
Right.
So we are what it would do first is that we will have severely minimize the situations that could lead to emergence of a new infectious disease. So what I mean is that we will have basically cut out factory farming, right? Cut out factory farming, which is a major source and will continue to be a major source for new viruses, new influenza viruses. So that alone will be a drastic improvement. But if we don't, but just being vegan alone, it's great. And that has to be something that we should all be considering right now. We don't need to eat animals. We can be better off. We can be far healthier. Our environment can be healthier. We'll be happier. Animals will be happier. It's a Pollyannish world in so many ways. If we just cut out eating animals, we can solve so many problems. But we also have to look at other ways in how we interact with animals. And we have to look at the wildlife trade, as I mentioned. We have to look at the global population of humans and our destruction of animals' natural habitat to really, truly look at and minimize all the potential ways that a new virus could emerge.
Right. But are we talking about an order of magnitude, 2 orders of magnitude reduction? I mean, right now we are getting like, a novel virus every few years that we are hoping that it doesn't kill us off, right? A novel virus that's serious that every few years. I think that the swine flu happened 10 years ago. Was that right? When did
Yeah,
the
that's
last
H1.
pandemic?
Yeah, that was H1N1. That was in 2009. Yeah, and we were
2009.
lucky. We were lucky. That ended up, at the time, I was working at the Food and Drug Administration at the time, and we were very worried about that virus. Very, very worried, because the 1918 virus was also that is one of the worst pandemics ever in human history. Was an H1N1 virus as well. And so we were concerned that we were going to see a repeat in history 10 years ago. Again, we were very lucky. It ended up being a virus that spread easily among people, but not being so as lethal as we suspected and that we worried about. But the virus is still there, and the virus is still mutating among pigs, and still, it's being shipped around the globe. So as far as the order of magnitude of how much we could minimize the emergence of infectious diseases, if we cut out eating animals, I couldn't really give you the answer. But I would say that if the world went vegan, we would have cut out, I would say, one of the major contributors of emergence of new viruses that could cause pandemics.
Yeah, I imagine if the world went vegan and simultaneously we start eating to maximize our health as opposed to eating things that are making us sick, right? So that our immune system is also boosted along the way.
If we stopped eating animals, we would have far lower rates of so many chronic diseases: strokes, heart disease, many forms of cancer, diabetes, obesity, and all these conditions are making the impact of the coronavirus even worse. So people who have these conditions, underlying conditions, are getting sicker, are getting much more sicker, right? And are much more likely to die from the coronavirus. So just by reducing our risk for these other types of what we call comorbid diseases, other types of conditions and diseases, and improving our health overall, we do boost our ability to fight off a new virus like coronaviruses. Now, I will say this though, but I'm not going to. I'm not going to stay here and say if you're vegan, you're not going to catch the virus and you won't get sick from it. That's not the case. But what I will say is, in general, we know that the healthier we are, the more likely we can fight off infectious diseases. Right.
That's across the board. That's a statement that can be made.
That's right.
Right. Right. Well, thank you so much for your wisdom and for sharing with us your ideas. What is the one thing that we could all be doing to help you out?
To help me out?
Yes.
Oh God, help me get into the New York Times and the Washington Post and get public health agencies to take note. It's so difficult. It's so frustrating. There are people like me. I'm not the only one, but there are people like me who've been trying to get this information out there. And right now it's out among the vegan community, among animal rights people, some ecologists. But that's about it. Mainstream media just doesn't seem to care, at least in the United States, just doesn't really seem to care. So if there's anyone who has a good contact with the New York Times or any of these sources of mainstream media, please, that's how you can help me, because we need to use this time, because if we don't bring up these issues now, what's going to happen, what has always happened, what will continue to happen, is that eventually we'll get back to a relatively normal state again, and people will forget, and the panic and everything will disappear, and we'll become complacent again. So now is the time for us to spread this information. So if there's anyone who has a way to help me spread this information, then that's how you can help me. You can go to my website, and my contact information is there.
Awesome. Thank you so much. So I'll throw it open to audience questions now.
Hi. Okay, we have a couple of questions in the Q&A box. I want to ask a question first, if I may, and it ties into what you were just saying. You're a professional, you're an expert, trained expert in your field. You worked with the military and with the government. I guess, I know change needs to happen on all levels in all areas, but I guess my question is, like, are you in a position to impact government policy, or, like, where's the block, and where does that need, like, what needs to happen there in order for, for policy change? Does it need to come from the people? Can it come from experts like you working with the government?
I'm too far low in the totem pole to have had any kind of real impact, unfortunately. And I'm a minority voice, or I was. I'm not with the government anymore. I actually just left. But so I was a minority voice. And so unfortunately, I think what's really going to make people wake up is a significant number of human deaths. And right now, there's a call for ending the live markets in China. And that's good. But I will say that's a little too late. We knew about the threats from these markets 20 years ago with the SARS outbreak. Why weren't our public health agencies calling for that, the closing of those markets then? So let's say we do close these live markets. Well, we've closed one part, the end result of one part of the wildlife trade. We haven't addressed the other parts of the wildlife trade, and we haven't addressed industrial farming and the risk of infectious diseases coming out from these types of conditions and uses of animals. So I think that our public health agencies, unfortunately, aren't really going to pay attention until enough people, become very sick and enough people suffer. And that is a horrendous crime, in my opinion, and that's a horrendous failing by our public health agencies.
Yeah, no kidding. And lost my question there. Is that when you said it was the call only come to close the wet markets in China as opposed to worldwide?
So I think there's an increasing call to close the wet markets worldwide. And wet markets mean live animal markets, basically, where animals are sold live. They're often butchered on premise, but again, it's a good start, but it's just the start of what we need to do.
Right. Okay, thank you. So this question is from Big Fat Vegan Radio. Has two questions here. The first one, I'll read them to you one at a time. How do those of us on the clinical side get our fellow clinicians to believe the science over their own prejudices?
I wish I had an answer for you for that. It's the same thing. We're dealing with, for one thing, unfortunately, we're dealing with people who mostly eat animals. Right? So most of our clinicians, our healthcare workers, most of the people who work in our public health agencies eat animals. And so it's very hard for them to take a mirror and look at their own actions and how that may, not to put blame, but how our actions collectively can lead to this type of pandemic. The most we can do, I think, is just sending around articles. There have been some good articles in the UK media. Sorry about that. There have been some good articles in the UK media about factory farming. So like I said, in the UK, they seem to be a little bit better about addressing some of these issues in the mainstream media, but we haven't done that well here in the US at all.
Does that have to do with our ag-gag laws?
Ag-gag laws are a contributing factor, but no, that's not the only reason. Sorry about that. I gotta turn it off. People are in the United States, we look for quick fixes. We are not a country that looks to how to prevent things from happening. We're looking for drugs, right? We look for drugs to cure whatever ails us. No matter how destructive those drugs may be in other ways, that's what we look for. So we will eat what we want. We will abuse our bodies in however way we want. We will allow ourselves to become as unhealthy as we are right now. We have at least a 40% obesity rate in this country. And because we expect that there will be drugs there to help treat us. And that's the wrong way of looking at things. So there's so many complicating factors. And I think that if we really want to address these causes in the US, we have to look at our overall attitude about how we need to step away from looking for quick fixes and start really thinking more deeply, more comprehensively about how our actions can lead to problems and how we need to prevent problems in the first place.
Yes, yes, and be willing to give up our creature comforts.
Yes, yes.
Yes. Okay, here's another question. From a public health standpoint, how do we do better? How do we better prepare? Obviously, having real stockpiles of PPE, vents, and ICU space, being healthier as a population as well, what else can we do?
So if I understood correctly, so yes, we need to have a good supply of these products. And we need to treat our healthcare workers better than what I've been reading about as well. Many have been risking their own lives and their family lives to help patients, and we need to give them the respect that they deserve and to treat them, protect them as much as we possibly can. And I think the public health agencies are trying to do that. So I'm not going to damn everything that the public health agencies do. I know they're struggling in many ways, and they're trying to cope with this problem. This is a new problem for us here in the United States. So we're kind of, many people are learning as we go through this. But to better prevent, to better prepare, people talk about we need to have better surveillance methods, better ways to know if a virus is coming around the globe, if something's going to be a problem. The problem with that attitude is that it's hard to predict which virus is going to cause a problem. We thought H1N1 back in 2009 was going to cause a problem. It didn't. We thought SARS in 2003 was going to cause a major global problem. It didn't. There are a lot of people who did not expect this COVID to cause a problem, but it did. So it's very hard to predict which virus is going to be, one that we really need to be preparing for. So surveillance only gets us so far. And I know I'm beating the same drum. It's prevention, prevention, prevention. It's not sexy. It's not exciting. It's dull. It's hard. It's long-term. It's going to take a lot of time. It's going to take a lot of effort, but that's really the only way we can really prepare ourselves well for the future.
Okay, and those questions were from Dr. Priya Naik. Okay, and this is from Rob. You're trying to get institutions from experimenting on animals. How is that possible?
So the question is, what I hope to do.
You're trying to stop institutions from experimenting on animals.
We want to replace the use of animals in experimentation. So what we do know is that animal experimentation as a whole is incredibly inefficient and unreliable in telling us what's happening in the human body. Because even though there are overlaps in biology, in biological processes among all species on this planet and among mammals, it's the differences between species which are causing the problems in medical research. And so we have about a 9 out of 10 failure rate in drug development, largely because of the unreliability of animal experimentation. And that's been shown again and again across disease categories, and the publications in the medical literature are showing this again and again and again. But with so many other things, people are wedded to this way of doing things. There are many people who have done nothing but animal experimentation. The Food and Drug Administration is full of people who know animal experimentation. That's what they're comfortable with, and that's what they keep asking for. We need to change this. We need to get a better way. We need to have systems. We need to have testing methods that are based on the biology of humans, not the biology of monkeys, not the biology of dogs, not the biology of rats, but the biology of humans. And there are so many new testing methods that are emerging now and will continue to emerge if we just start putting more money into this line of work. And if our federal agencies started putting more of their funding into the creation of these better testing methods based on human biology. With the vaccine right now, what we're finding, one of the lag points in the development of a COVID vaccine is that many researchers are scrambling to find what they call the right animal model, scrambling to find the species or different types of animals who will not only contract the virus, but show the same symptoms as humans. And that's a laborious process. We may never really ever get, and likely won't ever get, any other species that's really going to replicate what's happening in humans with the coronavirus. And that process alone is slowing down the production of a new vaccine, the creation of a new vaccine. Now, if on the other hand, we had in the last 10 years created methods where we could really rapidly screen for viruses' effectiveness and safety using other types of testing methods that are based on human biology, we could be a lot further along in vaccine development today.
Thank you. Okay, so the next question is from Miles. Does anyone count the concentration of viruses over time, like carbon dioxide concentration is measured over time? Can we see a visual of virus concentration trend over time? As Dr. Rao proposes, we are to be holo ahimsa and to serve as the thermostat species. Perhaps we're also to be the virus regulating species as well. Perhaps this would be another good marketing name. Thoughts? Thank you.
I'm not sure I understand the question about virus concentration, so I may be totally answering a different question here. But there's what we call virus load, meaning just like if you're exposed to a higher quantity of a certain chemical, you may be more likely to be get sick from that chemical. And that's the same case with the virus. And we're seeing that with coronavirus. So certain people, like healthcare workers, may be exposed to higher virus load just because of the nature of their work. So more viruses, more virus particles. And that can make it harder for them to fight off the infection. Their bodies are more likely to become overwhelmed, and they're more likely to get very sick from the infection as well. I don't think I answered your question, and I apologize. I'm not sure I really understood it otherwise.
Yeah, I was I saw a statistic about the number of deaths from infectious diseases that kept going down and then started going up again.
I see.
Yeah, that's probably another way to look at that. Yeah.
Well, so even with the alarming rate of death that's happening with the COVID-19, it's still not nearly as high as the number of deaths from chronic diseases each year. Mm-hmm. But this is new and this is scary, and so that's why we react the way we do. But there's been among the public health agencies, and specialists, there's been talk of a resurgence of the infectious. I'm trying to think of the infectious era. Before, it used to be back in the turn of the century, and before that, we were succumbing to infectious diseases more than anything else. And then good sanitation, good overall health, good nutrition really squashed those infectious diseases. Now, and then in turn, what we saw instead was a rise in chronic diseases. I think there's a strong possibility that we're going to see the flip happen, and that chronic diseases may start to go down to some degree, and we might start to see a rise in infectious diseases. And I will say that there's several factors that can contribute to that. Of course, we've already talked about the emergence of new viruses, but there's also the problem with antibiotic resistance. Now, a lot of people think antibiotics fight off viruses. They don't fight off viruses. They only fight off bacteria. But what makes a lot of viruses so deadly is not the virus itself, but what happens is when people catch a virus, like they did with the 1918 influenza virus, like probably what's happening here with the coronavirus, your body becomes so overwhelmed that you become very susceptible to superimposed bacterial infections. And so people often succumb from the secondary bacterial infections that follow. And this is what happened with the 1918 pandemic. Many people, many people succumb to the bacterial infections that followed the virus. And if we don't have good antibiotics, if we have so much antibiotic resistance as we have now, then we are left with very few drugs that can fight off these secondary bacterial infections. And one of the reasons why we have so much antibiotic resistance is because we are pumping antibiotics into animals in industrial farms, because the conditions are so miserable. This is how industry is trying to keep these animals alive and so-called healthy enough until they kill them for meat production and eggs and dairy.
Yes. Okay, here's a good question. How can we get this information to our next presidential candidate?
If anyone can get me a meeting with, let's say, with Biden, I want your number. Yeah, just contact me. I'll go straight to him and talk to him. I'll talk his ear off.
Awesome.
Okay, let's spread this far and wide with that question in the comments at the top. All right, the next question is burying bodies storing the virus underground? Might they work their way back up? Should the body be cremated to kill the viruses?
The viruses will only live so long. Viruses are what we call obligate intracellular organisms. So they're different from bacteria. They're different from other types of organisms because they have to, in order to replicate and survive for a long period of time, they have to get inside other mammalian cells. So when a body dies, the virus will eventually become at least dormant. I can't tell you for sure that the virus will never emerge again from burying bodies, and who knows, some people suspect that, you know, we might uncover viruses by digging in the Arctic, and some viruses that have been hidden there or buried there for centuries. I can't really answer that question, but I think the risk is pretty low overall.
Okay, thank you.
Mm-hmm.
All right, what do public health officials think about the latest rounds of viruses in confined animals? There is an avian flu in turkeys in South Carolina, the swine flu causing the deaths of millions of pigs in China. Are there any indications that any one of these in particular is high risk to jump to humans?
So I don't know all the details of each of the individual viruses and what testing has been done to show whether or not they have a high risk of jumping into the human population. All of these viruses have the risk of jumping into the human population. And as I said before, it's sometimes very, very difficult to predict which strains of these viruses can cause human harm and widespread human harm. And I can't answer for all the public health agencies, but I will say that these outbreaks of different strains of swine influenza and bird influenza have been occurring again and again and again and again for the past several decades in the United States and in Europe and in China and elsewhere. And our public health agencies have just historically just turned a blind eye to it. They don't seem to really notice until if and when it causes the problem. And only then do we really address it. And we don't address it by looking at the root causes again. We address it by what vaccine can we create? What drugs can we create? What do we need to do? What social distancing do we need to do to implement? What rules do we need to implement to prevent the further spread of the infection? These outbreaks of these influenza viruses in factory farms are nothing new. They've been going on for a long time.
Thank you. All right, there's one more here in the QA box, and then I want to go to Rebecca. I think she's got some from the Zoom feed. All right, this one, what is your favorite book? I see you have a big bookshelf behind you.
I do. God, my favorite book. All right, there is one book that I absolutely love, and it's called I can't believe I'm blanking on the name. Thorny Hold. It's called Thorny Hold. And it's a book that was written, I would say, in the 80s, and it's about a woman during the First World War in England, who moves into a little country house that she renovates. And it's just a quiet, kind-hearted book. She is kind to all the animals. She rescues animals. She's an artist, which it's something I like to do, and it just kind of speaks to me in many ways. It's a comforting book. It's a sweet, peaceful book, and it's called Thorny Hold. HOLD. Yeah.
Thank you. All right, Rebecca, are you with us?
Yes, hi, thank you everyone, and thank you so much. One of the questions, or it was really, what about monkeypox? A couple of people brought that up. Maybe you'd like to say a few words about that.
I think they were offering that as the answer to what was the disease that hit in the Southwest. Is that the one?
Yep, that's right. It was monkeypox. Thanks for bringing that up. Monkeypox is a relative to smallpox.
Okay, great, thank you.
Uh-huh.
And the other person, Carol mentioned that we might consider, or you might consider, or we might consider sending press releases to news agencies that serve many individual media sources. And she mentions a website, which she listed there, en.wikipedia.org/wiki/news_agency. So I don't know if you have a statement that you might make to some of these news organizations.
I don't know if they would ever read it, though. That's the only thing. It'll probably get lost in the pile. Thank you for the suggestion. I'm a fellow of the Oxford Center for Animal Ethics, and we did issue a press release about 2 weeks ago in which I made some statements about the risk of infectious diseases and its relation to how we treat animals. And I'm looking into some collaboration with some other organizations on op-eds on the topic. But as I said, it's really difficult, and it's very frustrating. It still seems that we're minority voices in the crowd when we're trying to bring up these topics.
But I think we have to keep at it. It will happen.
Yeah, I will keep at it until the day I die. So as pessimistic as I may get at times, it doesn't stop me. So I keep going, because we have to. We can't not keep going.
Right. Dr. Nayak mentions that there is a symposium this summer on the alternatives to animal testing, and she also brought up Dr. Bernard and the PCRM, who are lobbying heavily, to end animal testing.
Right. Yeah. There are several organizations that have been working to help replace the use of animals in experimentation. And the Center for Contemporary Sciences, which is what I'll be heading up, its launch will officially take place in May, a few weeks away. And we hope to have some widespread impact and really make a significant improvement in how we do medical research that is far kinder to animals, but also far kinder to us, and is better for our health as well.
Okay, and I have a question. I've noticed people around here are saying that their doctors are recommending a plant-based diet, which is just great. And I'm wondering if you and your colleagues, if you've noticed a change in your colleagues in moving toward plant-based diets, or how do they take what you're doing?
So I have overall over the past, I would say past 10 years, I've seen a slow change in the number of doctors and other healthcare workers who are more open to plant-based diets, vegan diets. In my direct line of work, it really had nothing to do with that. I was working in traumatic brain injury. But it definitely is a positive sign, and I'm really happy to hear that. And I think also the climate impact that we've been having has also been a wake-up call for many to start really thinking about what we eat and how that impacts our earth, how it impacts our environment.
Great. Thank you very much.
You're welcome.
I don't see any other questions here, Deborah.
Maybe
Okay,
I'm not
we
seeing
do
the
have
ones I'm
some.
seeing. Let me see, because I do
Oh.
see a couple more that have come in. Did
Go
you
ahead.
want to get some, Ann?
Yeah, I have some ready to go.
Okay,
So,
I'll go after you. Go ahead.
okay. The first question on the Facebook feed is again about developing vaccines and drugs without using animals in any way. And could you maybe share a couple of other ways that drugs might be developed?
Yeah, so there's a new technology that's been garnering a lot of enthusiasm, and it's called organs on a chip. And basically, you distill a human organ into a microchip. So like you take a human lung and you distill it to its microcomponents. You create a lung on a chip. And this lung on a chip breathes, it functions like a full lung in many ways. It's not perfect, but the thing is that it is based on human biology, it's human cells. And at the micro level is where everything happens. It's where disease occurs. It's where the drug will interact and cause and either help combat the disease or cause safety issues if there are safety problems with the drug. So these organs on a chip are great. It's a great new technology, and there are different types of organs on a chip. There's a liver organ on a chip, a lung organ on a chip. There's a mini human brain on a chip. And eventually what researchers hope to do is link these organs with a lymphatic system, with a circulatory system, nervous system perhaps, and create a human body on a chip. So this is a great tool, potential tool for rapidly testing the safety and effectiveness of a new compound. This is just one though, and there are other technologies. There's growing human organs in the lab. That's more sort of a little bit different from a human organ on a chip, but growing a more three-dimensional structure, a miniature component of an entire organ, for example, that we can use to test and use for even potentially for organ replacement, right? Organ transplants. So those are some technologies, and there's computational methods and others. But the thing is that these are just what we know of right now. And we spend, as a society, we spend so little money into the development of these new technologies in comparison to how much of our tax dollars are going into animal experimentation. So if we just flip that, or even if we just increase the amount of money that we put into these new technologies, even by 10%, when we're talking immediately 10%, my God, we would be so much further along today than we are.
Right. Yeah. Thank you. Thank you very much. That was really interesting. Another question, it's actually a series of questions. They're all related to factory farming. What's the best way to go about phasing out factory farms in the US? Do you think it's politically possible to pass legislation to phase out factory farms like Bernie has proposed? Or should we target meat and dairy subsidies? And should the policy fall under the Green New Deal? So some factory farming and some politics thrown in.
I'm no policy expert, so I wouldn't be able to tell you exactly which is the best way. I know that people, groups have been trying for a long time to change the way subsidies are to change that. And because so much of our subsidies are going to support factory farming, meat, eggs, and dairy, as opposed to the production of vegetables and grains and fruits for the human population. So that's something that I know has been tried again and again. It hasn't worked in the past, but maybe now with the climate change thing, and I think with the younger population more open to at least more concern about how we are impacting our planet, we will have greater opportunity to make some of these policy changes in the next decade. Other than that, I wouldn't really be able to tell you which would be the best way to tackle these industries.
I think that's a great answer. Thank you very much. The next question is about the number of people who are dying from COVID-19. The majority of them are either smokers or have a pre-existing condition. So why aren't people focusing on going plant-based and reducing their pre-existing conditions and thereby protecting themselves from the coronavirus?
Well, it's a good question. So diseases don't get reversed that quickly. So even if you were to suddenly go vegan tomorrow, let's say you have diabetes and you suddenly went vegan tomorrow, doesn't mean that your diabetes is going to be gone tomorrow. It's going to take some time. If it does go away at all, or more likely at least become more controllable. So it's not the answer to everything, in the sense that it's not a quick fix. It's a long-term fix. It's a long-term prevention. And being a vegan isn't necessarily going to make you resistant to the virus. And, so I want to be very careful and again, reiterate, just because you're vegan doesn't mean you can't catch the virus, doesn't mean you can't get sick from the virus. Healthy people are getting sick as well, and getting severely sick. There's so many different circumstances and so many things we don't know about the virus and how it affects us. But in general, yes, the healthier you are, which also includes being on a plant-based diet, being vegan, you're more likely to be healthier overall. These will help prevent, will help protect you in the long term from many types of diseases, including infectious diseases in general. And I'll just say that again, in general.
Right.
Yeah.
All right, thank you.
Yeah.
And then I have another question. Apparently the Wuhan Institute of Virology was doing coronavirus research. Is there any connection to the fact that this coronavirus was released at the same time, or at the same time that they were already doing research, or are there many places doing research on coronaviruses?
Well, now I would say there are probably many places doing research on the coronavirus. I can't answer that question. I don't know enough about it. I don't think anyone does.
Okay.
Yeah.
All right. And let's see. Sarah wants to know, name one vegan who has died from COVID-19. I don't know if you can do that. I don't know if anyone on this call.
No. And again, I think it's really important for us to really be careful about what information we say. So being a vegan doesn't necessarily mean you won't catch the disease or won't succumb to the COVID-19. Again, you might be better protected just by being healthier overall. But again, we don't know. We don't know all the answers. And there are so many factors in place here. So the people who are more likely to catch the disease right now are, for example, healthcare workers. Most of them are not vegan. So they're at a higher risk just because of the nature of their work. First responders are at a higher risk just because of the nature of the work. So we have to be very careful. We have to, if we want for people to listen to us and pay attention to us, we have to be as accurate as possible with our facts as well. And so that's the caution I would say. I know people who are vegans who have got the infection, and how many have succumbed to the illness, we can't answer that. There's our public health agencies, our hospitals are stretched far and thin just dealing with the infection as it is, to even begin to start looking into these things and start researching these questions. We haven't gotten to that point.
Right.
Yeah. All
right. Thank you. I think that's all of the questions from Facebook at this point.
Okay. Yeah, I see a couple of people saying I'm vegan. I got COVID-19 but recovered. And another one Dr. Priya saying that's just not data that is collected by our health professionals. So nobody would really have a way of knowing that. It's not something that's tracked.
That's correct. Yeah.
Yeah. Okay. So here's a couple from the QA box, and then we'll go back to the Zoom feed after that. Okay. What kind of epidemic are you most fearful of? A new influenza virus, a mosquito transmitted virus, ?
Influenza virus, by far. The death rate we saw with the H5N1 is ridiculous. 60% mortality rate. It is horrendous. Coronavirus is nothing compared to that. Nothing compared to that. As tragic and as horrible as the coronavirus is, it is nothing compared to H5N1. So yeah, mosquito-borne viruses are deadly, but again, they're not viruses that we transmit directly to each other. And so there are things that we can do to help prevent exposure to mosquitoes to some degree, like clothing and, unfortunately, chemical sprays and things like that. But the influenza virus is the one that I fear the most.
Do you fear one that would be a 60% rate that travels as fast as the COVID-19?
Exactly.
I mean, that seems like the worst of all worlds right there. Not to put fear into people.
That's exactly right. Again, we've either dealt, we've had viruses come out from factory farms that have either been contagious, very contagious, like H1N1 of 2009, or very deadly, like H5N1. The highly pathogenic avian influenza. So far, we haven't had a virus that's come out yet from a factory farm that's been both deadly and contagious. But that really is, it's just a matter of time for that to occur.
Okay. All right, here's another one from Dot. Says, I would love to see you talk more about different technologies to replace vivisection. Maybe a series where you talk about each, just an idea.
Okay, sure, I would love to do that. And keep a lookout for the Center for Contemporary Sciences. We're just starting, like I said, so we'll have a website up soon, and we'll have some more information, and wish us all the best. And we're going to be looking for support as well. So if anyone's out there who wants to help support us, I welcome it.
Thank you. Okay.
Yeah, we'd be happy to invite you back after that,
Sure, thank you.
Okay, there's a big thank you from Miles. I've got some questions on Zoom. He says, thank you for your research and all the work you're doing to educate others. The question from Harriet Merson is, will it be possible to follow up research to determine if being on a healthy plant-based diet helped to provide immunity against COVID-19 or to mitigate the impacts of the disease?
So the answer to that question is a little difficult. Right now, we're just trying to deal with taking care of the patients, right? So that kind of research isn't happening. And there's very little resources right now to do any kind of real research into who's more likely to succumb to the disease and who's not, other than what we already know. For example, we do know that men are more likely to succumb to the disease, and we do know that people with chronic conditions and the elderly who are more immunocompromised are more likely to succumb to the disease. But other than that, there hasn't been a lot of research, just because we're scrambling just to try to hold back this virus right now. Whether or not that will be some research study that will occur in the future, it depends on the research institution. There's so many factors, and I don't know if there's going to be enough of an interest among the academic centers and by our public health agencies to really ask that specific question.
Thank you.
Yep.
Michael Worsham asks, how exactly does the illegal trade in wildlife and animals facilitate or enable the illegal trade in wildlife and animals?
Yeah, so what is happening is that the illegal part of the trade is also occurring as part of the legal part of the trade. So like, for example, in the US, at any given time, we might have 100 inspectors inspecting wildlife imports. We're talking about millions of animals each year being brought into the United States, and maybe 100 inspectors. And what they're basically doing is, if they even inspect a shipment of animals, they're doing a cursory glance. They're looking at some animals. Among those animals who are part of the legal trade could be, and have been in the past, animals who are considered illegal to be traded. So they can be snuck in those ways as well. And we also know that the legal trade in animals also is big business, and that contributes monetarily to the illegal trade. And so I can go on, there's so many other ways, but it truly is a cover. And even beyond that, again, a virus doesn't care if it's being transmitted through the legal trade. It doesn't care if it's being transmitted through an animal that's been legally traded or illegally traded, right? So the same situations that can lead to us catching a new virus through the illegal trade exist with the legal trade. It's the same thing. So we need to address all of it if we really want to minimize our risk of new infections.
Thank you. Another question from Britt is, what is the reason that the media never speaks about the connection of animals in regards to these pandemics?
Well, unfortunately, the media is, and our public health agencies are, I wish I had an easy answer for you. Well, one answer I could say is that, most people who write for the media, who are the gatekeepers of the media, who are the leaders in our public health agencies, they eat animals, right? Most of them eat animals. And I think I mentioned before, it's very hard to put a mirror up to your own activities and really take a hard look at what we as individuals are doing that may be contributing to an overall problem. And there are other factors. I don't know. I think it's because this has been coming out from the animal rights community. It's been the animal rights community that's been saying, listen, we need to take a hard look at how we treat animals because these are the problems that come about by our cruel treatment of animals. And the media doesn't care about animal rights. And so they've seen it as an animal rights issue. And until it becomes a human problem, really, I think most of these mainstream agencies and media sources just aren't going to care about the issue. And so right now, media has brought attention to the live markets in China, just because that is the most direct link we have to the current virus, to the coronavirus. But I suspect they probably won't bring up industrial animal farming until, and I say until, not unless, but until the next pandemic comes from a factory farm and causes problems in humans. So it's just a matter of interest. I think, as a species, we care about ourselves, unfortunately, far too much more than we care about others. And that's coming back to hurt us as well.
No, it's interesting you mentioned that because it looks like right now it is affecting us, right? It's affecting our species. We are sitting at home. I can't even see my granddaughter.
Yeah.
Right. So clearly it's affecting us. And by doing all the social distancing, we are buying some time for our species. So we have kept our infection rates low so that, we get some time to heal ourselves if possible, right? So it's such a waste if we use this time not to change anything.
I absolutely agree. Absolutely agree. And we are a forgetful species. If as I mentioned before, we when things get back to better, when things get better, we will likely forget and go back to a lot of the same bad habits that cause these problems in the first place. But you're right. If we don't bring up these issues now, as much as people don't want to hear them now, as much as people don't want to listen to this now, but if we don't bring it up now, we're going to lose this opportunity to bring it up and really have an audience at all.
Right.
So I have a question here about a release date, and I'm not sure if it's about a release date of a press release or a release date of something you've written or your new organization.
Oh, okay. So all right, let me see. So release date of the new organization. Well, I moved full-time into it in May. But it's going to be a little slow for us to get our website going and things like that. So just look out for it. And you can always look at my website and join me on Facebook, and I'll put out information as we move along in the area with the Center for Contemporary Sciences. Book, I released the book last year. It's called Our Symphony with Animals on Health, Empathy, and Our Shared Destinies, which really looks into how our overall relationships with animals affect our well-being, our physical and emotional health, and it addresses some of these issues that we're talking about now. And that came out, it came out spring of last year. And a paperback version will come out in this fall. And you can get that, like everything else. You can get that on Amazon. You can get it, but you can get it in other online bookstores as well. And as far as a press release, maybe you're talking about when op-eds may come out. I'm working on that, so I don't know. And it just really depends if anyone's going to take the op-ed and publish it. So that is totally up in the air right now.
Great, thank you. It's good information that you've shared. The other question is, are you doing any fundraisers?
I will be. Yeah, we need money, as you can imagine. A lot of it's a scary time to be starting a new nonprofit organization with everything going on with the economy. Yeah, we'll be putting up information about the Center for Contemporary Sciences. We're doing fundraising and online fundraising and fundraising in other ways. So please do keep in mind out, and you can always reach out to me. If you want to go ahead and donate now, I will not say no. So yes, we need all the help we can get. And thank you very much for that.
Yes, that was very nice. Thank you very much. That's all the questions I see here.
Hey, Aysha, can you say your website for us? There's a couple people that have asked for it, and I just want to make sure it gets posted in all of our links here.
Yeah, you can just Google my name and you'll see it, but it's www. It's a long site. So it's www.ays as in Sam, H as in Harry, A again, K, H as in Harry, T as in Tom, AR.com. So it's AyshaAkhtar.com.
Great, thank you.
You're welcome.
Awesome. Thank you so much. This has been an amazing session. I'm so glad that you could join us and give us the expertise that we desperately need in these times. So,
I'm very happy to be here, and it was nice to have people be able to ask me questions. I really enjoyed it. I enjoyed the questions, and thank you all for joining. And like I said, any way you can help us get this word out about these links between how we treat animals and the many ways we are hurting ourselves, please do help us.
yeah, we definitely will. Yeah. And tomorrow we are going to be speaking with Reverend Fletcher Harper, and we're going to be talking about how to get the faith community involved in this response to the COVID-19. So thank you all very much for joining us, and join us again tomorrow at 1 o'clock, same time.
Thank you.
Thank you, everyone.